Good evening, everyone. This is Saket. Welcome to the BITSAA Sahaaya webinar series, which we've been doing for the last 2 years now. I'm a graduate of BITS Hyderabad from 2014 batch, and I did my bachelor's in pharmacy and master's in biotechnology. And I'm currently a volunteer with BITSAA Sahaaya. Sahaaya was formed in 2020 with the objective of raising mental health awareness and also to reduce stigma related to mental health issues among the students of BETS campuses and also alumni of BETS campus, which is a very big community right now. So for today's webinar, we have Ishita, who is a PhD student in the Department of Clinical Psychology, NIMHANS. She's working on trauma, and her work is trying to assess trauma, and she's trying to build a scale to measure trauma. So she'll be discussing today about trauma, what is trauma, how to deal with trauma, and how to identify people facing trauma, what are the signs and symptoms of it, and what are the best measures one can take to overcome the trauma one is going through. And it's over to you, Ishita. Please, we can start with your presentation.
Okay, thank you. I think I'll start with, so first of all, I don't have anything to refer to, so you'll have to look at my face throughout. So
Yeah, we can have it more like an interaction.
Yeah. So we have heard the word trauma probably in a lot of contexts, and it would be nice to know what what the word trauma itself sort of suggests to you, and I could build on that, so that would be useful.
So the trauma we refer to, does it have anything specific? Because we usually use the word trauma in a very general sense, right?
Exactly. Yeah.
But there might be something which is very specific for trauma, which classifies something as trauma. What is that?
Right. So if you look at, so when I'm referring to trauma here, I'm talking about psychological trauma, not head injury as such. So if you look at diagnostic classifications such as, DSM-5 or ICD-10, you will see that they speak about a threat to life, which is, which is something that's required for some experience to be called trauma. But other theorists or other psychologists, they say that it may not necessarily be a life-threatening incident or experience or series of incidents for that matter for it to be traumatic. It could be anything that is very overwhelming. It could be something that really shatters your beliefs about yourself, the world, and others. So it basically forces you to sort of reorganize your thoughts and feelings and even your idea of the self and the world. So it's something, basically it's almost like a as if I had to use a metaphor, it would be something like a derailment from the track of your life in a way. So mostly we are talking about negative events, things which cause a lot of pain. So if I have to give you examples of what could be trauma, the ones that you will find in most diagnostic systems is, for example, loss of a loved one, or physical or sexual assault, or being part of an accident like a road traffic accident, or being a victim of any sort of abuse, whether it's emotional, physical, any of those things. And also, in some cases, secondary and tertiary trauma is also recognized, in the sense that, so secondary trauma is when it is not harming you directly, but it is something that has affected somebody who's close to you. So you're a witness to what is happening. So, for example, you may have witnessed riots, for example, or you may have witnessed a road traffic accident or somebody being murdered and things like that. So it didn't happen exactly to you, but to somebody when you were present. And this is another thing. The
So
secondary
this
trauma could also be that you.
could be something like caregiver stress, right? Somebody who's taking
Um,
care of caregivers. Uh,
I wouldn't call it stress. So now we need to differentiate between stress and trauma, because stress would be anything that is challenging your coping mechanisms, right? So if we had to arrange it on a continuum, stress would be on the lower end of the continuum, and trauma would be on the higher end of the continuum, basically. Um, so what I have seen is that it caregiver stress is a different thing. Of course, it's more of a continuous process that's just going on. Trauma could also be a continuous experience. It's not that it has to be a single incident. It could be a series of incidents. It could be like multiple incidents that are spaced out over time. So it could be any of that. Like it could be temporally and situationally very varied in different contexts. But if we and one thing that is very common is I mean, secondary trauma is very common in certain populations, like say emergency workers. So for example, people who are say firefighters, or people in the police personnel, or emergency rescue forces, and even therapists and doctors for that matter, because you do witness a lot of people coming in who have suffered a lot. So being a witness to their trauma is can also be traumatic for you. And the other thing would be tertiary trauma, where you did not see it happening, you did not hear about it happening, and it did not happen to you, but it has affected you because it has been a part of your community or a part of your family. So previous generations would have experienced the trauma, and that would still be having an impact. So for example, if we look at the effects of partition, for example, in our country. So probably our generation, as in if we talk about millennials, they would definitely would not have experienced partition directly. Their parents also may not have, but they have heard about it, and it has impacted their grandparents. So that's how, and the effect still trickles down to the current generation. So yeah, so if we I mean, that is how I would like to understand trauma. And the other thing that I have felt while reviewing literature on trauma is that we are trying to define trauma for others too often. And I don't think that's actually fair, in the sense that, say, for example, I was made to stand outside my classroom one day. And that is something that's not a very big deal for somebody, probably. It didn't matter to them. But for me, if that incident sort of prevented me from going to school for the next 1 month, then of course it was traumatic for me. So even though it wasn't a threat to my life, it was threatening enough for me to disrupt my usual activities of daily living. So in that case, it is traumatic for me, even though it does not appear to be traumatic for you or for anybody else. And I think that's a very important um, aspect of trauma that we need to understand, is that
Also, it might
we,
be, just to interrupt you, it also might be
yeah,
very contextual, right? Because if somebody
correct.
undergoes trauma, but the surroundings are very positive, there's a lot of, there's an atmosphere of positivity and hope and care and concern
Hmm.
that might
Hmm.
make the person recover much quicker from the trauma.
Absolutely, absolutely. Social support plays a huge role in trauma. I mean, in dealing with trauma. And there is also something that you might have heard of, which is called re traumatization. So the trauma experience has occurred, and the way people respond to it can actually take you back to that trauma experience and make you relive it. So for example, the way rape victims are interviewed in the court, for that matter, or by the police, that can be very re-traumatizing, because you are being asked to narrate very intimate details in ways which do not provide you any sense of safety. So even we also take trauma histories, like in as a part of therapy we may be taking a trauma history, but while doing that, while asking questions about trauma, you need to ensure that the person is feeling safe in the current moment, and they are not being able, I mean, they are not being forced to reveal any information which they are not comfortable with. So where it could be an insensitive remark, or it could be labeling of the person in the society, which could be re-traumatizing. So yes, definitely social support is something that really determines how we deal with trauma experiences.
Right. Yeah. So in that, from just what you said, you've been interviewing a lot of people who've undergone trauma. Is there anything,
Hmm.
is there any common underlying factor which a lot of people report?
um I wouldn't say anything that is common as such, but at least from the, like, around at least 200 to 20 people, to 200 to 50 people that I've spoken to regarding trauma so far. One thing that I have been really inspired by, I would say, is how people do not let their trauma experiences define them.
Define them.
So yes, so I've heard stories where, it's been a series of trauma events, and that's how the person, when they're recounting their life story, when they're talking about their lives, it's just one incident after the other. And after all of that, the person is able to say that I'm still fighting for XYZ. So what was probably, if there was one common thread, that was probably the this indomitable
Yeah.
spirit, that
Right, right.
and
Not
that to live life in their own ways.
correct. Not letting it define the person.
Yeah.
That's wonderful. And usually, how much, because somebody is going through trauma, what they really want at that moment is they just want to overcome it as quickly as possible. But we know that it doesn't happen like that. It takes time. This so much happening biologically as well. Trauma leaves an imprint
Yeah.
biologically as well, and it takes a lot of time for the brain to remodel and get back to
Hmm.
baseline state. So,
Right.
how does one deal with a situation like that? What are the methods which uh, might help a person in that state?
Well, that's a very difficult question to answer, primarily because um, it would really depend on the person's context, the support available, and the person's physical and mental state at that point. So, for example, if there is somebody who is going through, say, I mean, who has already suffered multiple losses, who's grieving, and then there is another traumatic loss which happens, their way of handling it, or their way of responding to that experience, would be very different from the person who has never experienced grief in their life till this point. And yeah, so there would be too many factors which are affecting your response to the trauma experience for us to really say that, okay, this might help. But one thing that I have, I mean, I feel that it may help, it's just my personal understanding, is that seeking support does help in many occasions, because in a traumatic experience, when you are in the center of the storm, you're not able to see the entire picture. So somebody who is not part of that, or who is really not suffering the way you are suffering, may be able to give you some hope or some ideas or some resources which you can use to get out of that storm.
And
So
just to add one question to that, uh, in that state, usually people don't feel like sharing what they're going through because they don't
of
want
course,
to be vulnerable. What do you
exactly.
suggest to such people? Like
Sorry, I
what do you suggest to people like that who are, who don't want to share because there's a stigma surrounding trauma? How do we normalize it? It's okay to have trauma.
I don't think that is like entirely possible, because trauma is something that's not it's not like waking up in the morning and taking a bath, right? It's not
Right.
something that's so like run of the mill. It is something that is very uh, very odd, so to say. It's a very unexpected sort of an experience. So even if it is something like maybe losing your fetus to a miscarriage, even though it's something that happens to a lot of people, how I experience it will be very different. So when people do not want to be vulnerable, I would like to believe that they have very good reasons for doing that, because you know many a times disclosure actually leads to greater danger. So when your system or when your body knows that you're safe, you will be okay to share. So but then when you are having that need to share, or when you feel like you want to share, it is a good idea to explore what are the possible opportunities to share. But I would really not insist anybody to you know really go out of their way to disclose their current status, because
Okay.
uh, well, not everybody you're talking to has that ability to hold your emotions and to provide you that safety.
Okay.
So yeah.
If it's a therapist, I think even a lot of people, uh, when you approach a therapist, they kind of have a certain inhibition because family members might say, "Why are you approaching a therapist?" I think that's something
Correct. Yeah.
need to be
Yes.
addressed.
And I think one and it's something that's difficult even among mental health professionals, in the sense that even when we have to seek therapy, personal therapy, it can get difficult for us because we are worried about what other colleagues will say. So it helps if people who are taking help from other mental health professionals talk about it, only but only when they're ready. Again, it is not something that they owe to anybody else. You do not owe any information about your life to anybody. So only when you feel comfortable, only when you feel like you want to share and that you will grow in some way by sharing it, is when I would say you should actually share. So yeah, and seeking therapy may come at a much later stage. Many of our patients who have had trauma experiences in the past come much later, many years later, also, a lot of times. And sometimes you do not even identify an experience as traumatic until you are really talking about some other problem. And then it just
It was
sort of emerges that, yes, this is the root cause of it, or this is where it all started. So
okay. And how to identify it? For example, someone close to you has it. What are some of the common signs so that I can see that this person might be going through trauma?
right, that is actually a little difficult to identify, because from what I understand through my academic exercises and through my clinical work, is that trauma cannot be defined in terms of what happened, but you can understand, I mean, you can label an experience as trauma only when you see the impact of it. So basically, when you see how devastating a certain experience has been, is when you can say that somebody has experienced trauma or somebody is experiencing trauma. So it would be possible to define something as trauma only by looking at its impact, not really by the nature of the experience as such. And if you are talking about symptoms and signs, that would only be possible if you have a clinical condition. Say, for example, if you have PTSD, where you are re experiencing, or if you have any other mental illness which has followed the trauma experience, right? So, I wouldn't really say that it is possible to identify from any behavioral observations that somebody is undergoing trauma. But if you notice that somebody around you has really their interaction patterns with other people has significantly changed after any specific experience that you are aware of, maybe it would be useful for them to, or and for you also, to just inquire what has happened. But again, that is something, um, since trauma is something that's associated with a lot of shame, a lot of guilt, most of the times, because it is something that makes you feel very powerless and helpless.
Right.
And there is also this component of, especially if you're suffering alone, there is this component of, I let this happen to myself.
That self guilt.
So exactly. So that blaming yourself is something that's very common when it comes to a trauma experience. Even when it comes to losing a loved one, there are so many people who say that, I did not, or I could not do much to save this person. That's a very natural thought process which comes up. So we can't really expect that I'll walk up to a friend of mine and I ask that person that, are you going through a traumatic experience, and they would say yes. um, because many a times we sort of see it as a punishment for our wrongdoings. Many a times we see it as an inevitable consequence of some silly mistakes that we have made. So, like when, say, for example, a financial fraud or something like that has happened, and even though I know that I should not be doing XYZ, I ended up doing it, and then it happened. So, of course, then for me to label it as trauma means that I do not make myself entirely responsible for it.
Right.
So that is a very difficult thing to do, actually, because there is a phenomenon which says, which is called, I think it's called victim blaming. So we tend to sort of put the onus on the person who is suffering, because that in a way reassures us that we will not go through the same thing. So if somebody has been robbed, for example, the first question that we ask is, where did you keep your wallet, or where did you keep your phone, right? Because we want to be sure that we don't do that, so it doesn't happen to us. So bad things happen to people who were doing bad things or who were not careful enough. So that's how it goes, because we would like to believe in a just world. We would like to believe that good things happen to good people and bad people are punished. So that's a way of protecting our own selves also. So it is difficult for somebody to identify experiences as traumatic many a times.
Right. If some, for example, if somebody is going through a traumatic experience and the person really wants to share with somebody, and they come and share,
Hmm.
how does a person respond to the sharing? Because he is not trained
Yeah,
enough, or she's not trained enough to deal with such an intense situation. So, what is the best
right,
way
right,
to? Mm.
right. So a few things which I've seen have worked is, one, not to jump in to share your experiences. Like, you may have had similar experiences, but it is not necessary to talk about it at that point. So first thing would be to listen, and to listen without trying to pass any judgments, in the sense that, not trying to assign responsibility to anybody involved in the narrative, because the person who is sharing may not yet be ready for it. They are just talking about it maybe for the first time, with you. So it's very important to listen and try to understand what the person is trying to communicate. So whatever you understand out of that scenario is something that maybe you could share with that person, that this is, so for example, how say I'm explaining a theory to you, and then you get back to me, right, saying that okay, this is what I understand from what you said. So even when it's something as personal as a traumatic experience, if you do the same, in the sense that you share what you understood, that may itself be quite relieving for the person. Also, if it is possible, it may not always be possible, and the person may not always know, also they may not be able to answer that question, but you can ask what the person needs at this point. What help do they want? Because just because a person is going through trauma, or just because a person is sharing a certain difficult experience with you, does not imply that they are incapable of helping themselves.
Correct.
So we need to know what their needs are, what their expectations are, before we jump into action. So, very broadly speaking, those are the few things that we need to keep in mind. And we don't really need to direct them to a professional immediately. Like I said, if they feel that they want to seek help, or if they feel that they are finding it difficult to cope with it by themselves, there will be some indication of that.
Okay.
So, it is very important not to offer solutions immediately, not to invalidate the person's experience, in the sense you should not make comments like, oh, that's not a big deal at all, everybody goes through this. You should definitely not start talking about your own like similar experiences or whatever you have heard of.
Mm.
And yeah, I mean, these are the very basic things that you can keep in mind, and try and listen till the person is done talking. Try not to interrupt that much if possible.
Yeah, I think just listening makes a big difference. Complete attention,
Yes.
listening to the person,
Yes.
making him or him or her feel that there's somebody to listen to me. That
Yeah,
feeling,
making them feel heard,
oh,
basically.
exactly. That makes a
Yeah,
big difference.
exactly.
And how do they approach? Like, what is the process of approaching a therapist? For example, especially students, right? They have
Hmm.
Most of the students do not have any idea about therapy, and the awareness is still very low among the
Hmm.
community.
Hmm.
How do
Hmm.
they start off the process? Where to begin, whom to approach?
Um, right. Okay.
Because
So,
students do not know the difference between psychiatry, psychology. Say, therapist or
hmm.
I go to a psychiatrist. That's the common
Hmm.
misconception a lot of people have.
Hmm. Hmm. Hmm.
How to clear that?
Right. So there are different kinds of mental health professionals who are working in the field. So there are psychiatrists who prescribe medicines and who diagnose illnesses. There are psychologists who do assessments and who provide psychotherapy. There are social workers who will be able to help with, family therapy a lot of times, then reintegration of the individual into the society, and basically providing social support, helping them reach the correct avenues for that. And there are also psychiatric nurses who would mostly be attached with doctors or psychiatrists. So the safest place, like as per my experience, again, the safest place to approach would probably be the nearest government hospital if you are looking for a psychiatrist, because most government hospitals do have psychiatrists now. It's mandatory actually to have a psychiatrist. So that would be probably the safest thing to do, but it is also very time consuming, because obviously in a government hospital you have a greater footfall compared to private clinics. Um, if you are looking for a therapist now, going in search of a therapist is actually a lot more difficult, because in today's world of Instagram influencers and people who believe that they can be life coaches, and life coaching is also a licensed profession. So it is it is a little dicey as to how you go around asking people for a therapist, because obviously you can't just ask any random person. They might ask you, like, what, why do you need a therapist and stuff like that. So again, referrals through psychiatrists would be a safe option, because they would be able to guide you to qualified professionals rather than doing a Google search or a search on social media. And also asking your mentors, if you have any, asking your friends or colleagues whom you can trust, again, would be a better alternative to just randomly searching on the internet. Because looking at their qualifications, looking at their experience is important before you start sharing such intimate stories with a stranger. And also, it even if it is a very qualified person, very well known person, all of that, even after that, you really need to be aware of how that person makes you feel. uh, just like, the best doctor in the world may not really be able to treat a certain illness in you on a certain occasion, the best therapist in the world may also not be a great fit for you at that point. So, if you feel unsafe, if you feel like you are being invalidated, if you feel like you're not being heard by your therapist, it may be a psychiatrist also. In fact, psychiatrists also offer psychotherapy, social workers also offer psychotherapy. So, that can also happen, that you are taking uh, psychotherapy from your psychiatrist. But how you feel in the sessions is something that's very important, because you are approaching a therapist to deal with certain things which are very difficult and very personal. And it is a very brave step, let's acknowledge that, because you are walking into a stranger's office virtually or in person and telling them like all sorts of intimate stuff about your life. So it you really need to give yourself credit for doing that, taking that first step, and also be very very aware of how you are feeling in the sessions. And if there is any discomfort, please do bring it up in the session so that it can be addressed as in, so for example, if I have to so I've been a therapist and I have been a client. Now, with my when I was a client, for example, there have been times where I felt very uncomfortable. So if I bring that up with my therapist, I get to express what the discomfort was. I am giving a feedback to my therapist so that they don't repeat the same thing. And also the way they respond to it, the way my therapist responds to critical feedback, gives me a very good indicator of whether I'm in safe hands or not. So it has happened many a times that my patients have told me that I felt really hurt by what you said the in the previous session or earlier in the session or whatever. So as a therapist, my response to that would be to try and understand what exactly in my behavior affected them, because um, it as a therapist, it's not my job to sit and tell a person what to do, what not to do. I'm not sitting here giving advice or passing judgments. I'm just trying to be a co-traveler for a person who is seeking help. They know what they want. They will even be able to figure out how to go about it. I just need to be there as a believer, as a supporter. So in that scenario, as a therapist, when somebody tells me that something was difficult for them or something really affected them in a very negative way, I would pay attention to it. I would try to understand what led to that experience, and I would try to remedy that also. Does not mean that your clients will always feel happy with you. But if your client feels unhappy and if they don't have the permission to bring that up in a session, that is dangerous. So many a times, because in our like Oriental cultures, we have a sense of hierarchy which is there, right? So treatment providers are automatically assigned a higher station than ourselves.
Mm,
So we like to believe, and we are taught to believe, that they know better,
mm,
you know. So that is not always true. If you are feeling uncomfortable, if you are feeling invalidated or disrespected, or if you feel that you are not being attended to, your feelings are very much valid, and they deserve to be brought up in the session. They deserve to be addressed and paid attention to. So,
uh, is there anything specific in mind which you wanted to share with students with regard to trauma
um,
and how to deal with it, catering to the student community in general, in specific?
right. Um, I think one thing that has happened with the COVID-19 pandemic is that we have become more aware of all of these psychological processes and mental health issues that people may have. But knowledge does not always translate into practice, right? So we have this thing that we refer to as knowledge, attitude, and practices. So it is very important for us to also reflect on how we see ourselves as humans, how we consider, or um, yeah, how we look at our own health, how much importance we give to our own feelings, past experiences, thoughts, all of that. And defining trauma may not be that important, but really being aware of our own thoughts and feelings would probably be more important, which would ultimately lead to identifying what was traumatic and has impacted our life in diverse ways. So, staying connected to our own inner selves is something that might be instrumental in our personal as well as societal growth. So, I think that's something that all of us would benefit from.
Definitely. Probably it's like the resilience, these kind of things build resilience in a person, which would help the person overcome it much quicker and better.
Yeah.
Do you recommend anything, any specific things by which a person can build resilience?
Um, well, I wouldn't say that I can, suggest a few things, but it
As you
helps
said,
to.
as you just said, that paying attention to the inner self, knowing what
Exactly.
the person is
Yeah.
going through, the feelings one is going through. That is probably
Right.
very important when it comes to resilience as well.
Yes. So some amount of introspection does help. Being aware of interpersonal dynamics, as in the nature of our relationships with others around us, the way those interactions impact us and the people around us, all of those things would help us to really identify our strengths as well as weaknesses. So I think being able to identify what are our strengths helps us to build on that, and that of course will buffer against the hardships that we face, because obviously as humans we cannot really know everything or do everything or be good at everything. So we will have certain strong points or certain strengths and certain vulnerabilities. So if we are aware of our vulnerabilities, again we can see how we can live with those, how we can be comfortable with those, because many a times we are not aware of our vulnerabilities, and that sort of just leads to us getting triggered and reacting rather than responding. So a response would be a more well thought out react not reaction, but yeah, in common terms, yes, it would be a more well thought out reaction to a stimulus rather than just a knee jerk reaction. So, ideally, we should be responding to stimuli, but that is not always possible. You can't always remain at that optimal level of functioning. But if we exercise our cognitive and emotional abilities to reflect on our behaviors and thoughts and feelings, I'm sure we can improve on that. So,
Uh, we have few participants. Do you have any questions? Anybody has any questions can uh, please ask Ishita, or you can put in the chat box if you have anything. Yeah. No questions. Very well explained. Well done.
thanks.
So, Ishita, do you have anything which you would like to say as a final comments, which based on your years of experience dealing with trauma and working on trauma?
Um, I think trauma is something that's not very uncommon. That's what my experience says in terms of interacting with my friends, with my relatives, with my clients. Um, what really makes a difference is us being gentle and kind towards our own selves as much as towards others. Because many a times, even if we are able to excuse others' behaviors or we are able to justify their actions, we are not really able to quote unquote forgive ourselves for speaking in certain ways or behaving in certain ways. So, giving ourselves credit for all the difficult attempts that we have made, all the times that we've put in efforts, even if those efforts really did not lead to any successful outcomes, we still showed up, we still tried. So that is what really, really makes a difference to our own well being in terms of physical health, mental health, and our social interactions as well. So, kindness as a practice towards others as much as towards oneself is something that is really, really important.
Right.
Is what I've, at least what I have felt. And the other thing which I have, I just came across this very recently, where there was this quote, I think, which speaks about how it is very easy to spot something that you're looking out for. So if you are looking out for, say, you know, difficulties, or if you are looking out for signs and symptoms that somebody is going to harm you, you will end up finding more of that. So I do not believe in a sort of uh, mindset which says that you should see the good in everything or there is a silver lining in everything. No, some experiences just do not have a silver lining and you have really nothing to learn from them. Because for example, if I have to say that, if say I'm an orphan who has lost her entire family in war at the age of 5, there is nothing that is a silver lining there. So that idea that all your difficulties teach you something and they make you stronger, I honestly don't believe in it. And also, I feel that it is, what should I say, it's very easy to get swept away by all the problems that we have in life, because life is a series of problems that it is it's inevitable that we will have problems. But if we are not looking out for the things that are going right, just like we are looking out for the things that are going wrong, we will end up feeling more and more burdened, because we see problems wherever we look. Problems are there, definitely they will be there. Stress is there, sadness is there. There is absolutely no denying it. What really helps is if we can uh, also look out, we do need to look out for danger signals, we do need to look out for problems, definitely. But along with that, if we can learn to look out for the things that are going well, for the things that we have, and not just the things that we don't have. So a lot of research has been going on recently about gratitude practices and how that really impacts mental health and well-being in general. So I wouldn't say that it's a solution for everything, but that you know, that shift in perspective can really make a lot of difference as to how we go out into the world and how we interact. So there will be 8 things that are not going right for us, but it doesn't hurt to be also aware of the 2 things that are going right along with these 8 things. I'm not saying that you stop focusing on the problems, or you should not have negative feelings, or you should not be angry with the world. I don't think that's really possible, but it helps to sort of balance us and keep us grounded when we also look out for the things that we have, for the gains that we have made, for the things that we've achieved, or for the attempts that we have made for that matter. So that way, gratitude does work as a protective factor.
Yeah, that was quite deep. I would say what you shared with us is quite deep and very enriching. It's like hardly we get to speak to somebody who is working on something as intense as a trauma, trying to understand it, trying to uh, assess it, trying to help people deal with it. It's a very challenging thing, and it's, yeah, wonderful actually that you're doing this, which might
Thank
help
you.
many more people to deal with it, and also the scale that you're developing might help a lot of people to overcome trauma.
So the scale that I'm developing, it is basically not to assess trauma per se, because there are a lot of scales already available in the public domain also, which ask you about trauma exposure, as in the nature of the trauma that you've gone through. But again, human experiences has a huge variety. So obviously trauma also has a huge variety, and it's not something that I can just put in a checklist and all of it cannot be covered. But so I am not doing I do not intend to measure the kind of trauma that you had, but I'm trying to measure how you were able to respond to that trauma experience, in the sense how it impacted your life and how you tried to live with it or work with that experience. So that's why I've called it a trauma processing scale, in the sense that you know, you went through that experience or it happened to you, um, and after that obviously there are certain things that you've been thinking about, certain things that have stayed with you, it has changed the way you live your life. So I'm trying to focus more on how, as a survivor, you have dealt with the trauma, not so much on what really happened, but how you responded to, or how you reacted to what happened. And a lot of my participants have actually told me that, you know, this is really giving me a feedback on how far I have come from that time. So it is a tool that is meant to help you to reflect. You don't necessarily need to have PTSD or any sort of psychiatric diagnosis. I'm hoping that it will be something that a series of statements that when we go through, we would be able to understand ourselves as to where we stand in relation to that experience in our lives. So that's the aim.
So if somebody wants to approach you, how much time does it take to have these interviews?
It's not an
personal?
interview actually. Yeah, it's just a questionnaire. It's a self-report questionnaire which you have to fill, and it can be done online as well as in person, but whatever is comfortable. So they can reach out to me through email, or if they know any of my colleagues or friends, they can ask and get in touch directly also. That is quite possible. And it usually the entire process with explaining the study and the consent and all of that, including everything, it takes 30 minutes. So, yeah.
Yes. Any of the participants have anything to ask? So if there is nothing, then we can wind up.
Yeah.
I think listening to all these stories would have made you so much more kinder, isn't it? In terms of
Yeah.
how you
Yeah.
look at people, in terms of how you
True.
relate to the suffering of others,
True.
because
Yeah.
it's a big difference, probably.
Yeah.
Yeah, thank you so much, Ishita, for talking to us on trauma and ways of dealing with it, and the skill that you're developing on trauma processing. And yeah, wish you the best for everything that you do.
Thank you.
Thank you for coming.
Okay.
Sure.
Bye.
Bye bye. Thank you so much.
Bye.
I stopped